So I'm going to take you through some controlled articular rotations, or CARs for short. So CARs is where we take each of the joints through their full range of movement in a pain-free range. And just like we brush and floss our teeth twice a day, we should be taking our joints at least once a day through their full range of movement for their health and longevity. It's that classic saying, if you don't use it, you lose it. So we're going to start with the neck. So we're just going to roll the chin down towards the chest and then begin to scrape the chin along the collarbone over to the opposite shoulder, and then bring the ear to the shoulder, and then almost as if you're painting the ceiling with your chin, slowly begin to take it over to the other side. Bringing the chin to the collarbone, slowly circling it back to center, and then we'll take it to the other side. So circling it around, and this should all be done in a pain-free range. If you feel any pain, then you make the movement less, but we should still be taking the joints as much as possible through their pain-free range as often as possible. Bringing it back to center, and then we'll do that one more time. Taking it around, ear to shoulder, painting the ceiling with the chin, ear to the opposite shoulder, chin along the collarbone, and then taking it back around. Nice, slow and controlled movement. Moving in a mindful way, and then from there slowly stacking your head back up. From there we're going to move into the shoulder blades. So we'll do both at the same time, and we want to limit as much as possible any movement into the elbow or the arms moving out to the side. So we're going to keep the arms by the sides, slide the shoulder blades up towards the ears, squeeze the shoulder blades onto the back, slide the shoulder blades down, and I have to try really hard not to bend my elbows. So bringing the shoulder blades forward, sliding them up towards your ears, sliding them back, down, forward, up, back, down, forward. And then we'll reverse that movement, so we'll take it back, up, down, back, up, down. Last one like that. Take it back, up, and down. Good. We'll bring it into the elbows. So I think elbows often get neglected, and we forget that we have a rotational ability in our elbows. So keeping the elbow pits facing forward, you're just going to bend the elbows, rotate the palms away, and then straighten the elbows. Rotate palms, bend, rotate, straighten. Keeping the backs of the palms facing you, you're going to bend, rotate, straighten, bend, rotate, bend, rotate, straighten. Good. From there, we'll come into the wrists. So we're going to bring the upper arm in towards the body, bend the elbow, bring the fingers in towards each other. You're going to take the fingers away from, down towards the floor, and then you're going to rotate the wrist in its full range in a slow and controlled way. And we want to limit as much as possible any movement into the elbow or the fingers. We don't want them to help us with that movement, and we really want to isolate that movement into just the wrist. And then we're going to reverse that direction, slow and controlled. And some of these movements can be challenging. Good. And then we'll release that, do that on the other side. So elbow in, keep the palm, the forearm facing up, fingers in towards each other, take the fingers down to the ground and then slowly begin to rotate the wrist, getting that full range of movement in the wrist. And the wrists are often an area that often gets neglected. And then we wonder then when we try to do planks and push-ups and other things with our wrists that they're not working as well for us. Just giving them a little bit of TLC every day. Good. And then letting that go. From there we'll come into the shoulders. So what I like to do to limit any compensation through my spine is bring my opposite hand onto the ribs so that I can begin to sense when I'm moving in other places other than my shoulder. So we're going to rotate from the shoulder, the palm facing forward. And then from there we're going to take the arm across the body, and we're going to again try and limit any accessory movement from the spine and just find that movement in the shoulder. I'm going to take the arm up, and then from there you're going to rotate from the shoulder, and it may look like the hand is facing forward, but we're not moving just from the forearm. And again, we're not finding that movement in the spine, we're finding it in the shoulder. And then you're going to take the arm back behind you, continuously rotating the shoulder into internal rotation. And then from there, you're going to find your full extension. And then you're going to begin that rotation back, slow and controlled. And then externally rotating, so the palm may face back behind you, but that movement is coming from the arm bone in the socket, crossing the arm in front of the body, back to the starting position. So externally rotating from the shoulder, cross the arm, across the body, reaching it up and over, and then you're rotating, and then continuously rotate as you take the arm back behind you. And it should feel like work, it shouldn't feel kind of easy, although there shouldn't be any pain or discomfort as well at the same time. You want to get that full range of movement through the shoulder. And then from there, you're turning the palm up and bringing it back to center. Good. Hand onto the opposite rib. Rotate the shoulder into an externally rotated position so the palm is facing forward. Cross the hand across the body. Bring the hand up. And then from there, when you get into your kind of full flexion, and it may look different for every person depending on your range of movement, what we want to limit is kind of trying to find that movement through the spine. We want to get the shoulder moving as a shoulder. And then from there, you're going to rotate, taking the arm back behind you, and as if you're trying to reach as far back behind you as possible. The hand comes by the side, and then again, you're finding that full extension. Rotate, bringing the arm back, finding that external rotation so the palm faces behind you, crossing it across the body, and then bringing it back to that starting position. Good. So from there, crossing the hands across the chest, coming into the spine now. Gently tuck the chin to the chest, keeping it in that position. You want to get a sense that the lower body is like a statue, cemented into the ground, and you're not moving from the pelvis down. And then from there, you're just getting a sense of rolling through the spine. And then you're going to rotate to the side. And then it's almost as if you're side bending to the side and then extending back and then taking it over to the other side. And then you're trying to get that full range of movement through the spine. Taking it to the other side, so turning to the side, and you're extending back. And we'll do one more to each side. So turning to the side, extending back. And this isn't a big movement. We don't have a whole lot of movement in the thoracic spine. It feels really good. Good. And then from there, rolling up. Next is the hips. So what I'd recommend is just placing your hands onto the wall so you don't have to worry too much about your balance. To show you, I'm just going to stand facing forward. So we'll do stand on your right leg, bring your foot forward, cross it across the midline, and then from there you're just going to, almost as if you had a piece of string on your heel and you're almost trying to get as much external rotation as possible through the hip. And then you bring in the knee up. And then from there, you're going to keep that position and take it out to the side. Wanting to keep that heel up as much as possible. And then from there, you're going to rotate around so that the heel lifts up higher or almost isn't in the same line as the knee. And then you take it back behind you. And then from there, I'll show you from the side, you're going to take the knee back, but without kind of doing it into the pelvis or the low back. So again, we don't have very much range here. And then you're going to rotate back around to how we started. We'll do one more on this side like that. Bringing the foot forward, crossing it across, lifting the knee and the heel up, and you're wanting to try and get that heel as high as possible to get that external rotation. And then from there, we don't want the pelvis lifting as well. Taking it out to the side and then begin to rotate around. It's hard to do and talk. And then from there, you're going to take the knee back and rotate back around again, lifting the heel, finding that external rotation, and then slowly lower. Good. On the other side. So lifting the foot, taking it forward, crossing the midline, lifting the knee, lifting the heel, trying to get that heel. Imagine a piece of string lifting that heel up. And then from there, taking it out to the side. And then begin to rotate, so you're finding internal rotation. Taking it around and back. And then from there, taking the knee back. And again, you're not finding that movement in anywhere else but the hips. Circling around. Finding that external rotation once again, slowly, with control, release. One more time. So lifting the foot, crossing across the midline, lifting into flexion and external rotation, taking it out to the side without the whole of the spine moving, rotating. So it's bad balance. And then from there, taking the knee back, rotating around, bringing it back into that external rotation and lower. Good. Next is the knee. So again, like the elbow, we often think of the knee as a hinge joint, but it does have a certain level of rotation. So we're going to incorporate that. So we're going to stand on one leg again. Again, to make it easier for balance, so that you can kind of concentrate more on what the joint is doing rather than the balance. Hand onto the wall. So you're going to bend the knee and you're going to, see if you can see better from this side, you're going to, almost as if you're turning your toes out and then move the leg towards straight, but not completely straight. And then from there, you're moving from here, the foot in, but it's not coming from the ankle. And then you're bending the knee and then rotating, moving it towards straight, but not locking the knee out. Toes come in, but not from the ankle. Bend, rotate, straighten, rotate, bend, straighten, and then keeping the toes out, bend, toes in, move towards, straighten. Good. So we really want to limit the movement of the, we're not moving from the hip, we're not moving from the ankle, but really moving from the actual tibial rotation. We'll do that on the other side. So bend the knee. So from the knee, rotate out, straighten, in, so my hip's doing that. Rotate, and then from there, move towards, straighten, to the other direction. Good. And then letting that go. And then from there, we're going to come to the ankles. So we're going to point the toes, not the toes, the ankle, going to stretch the top of the foot away, rotate and circle. And again, like when we was doing the wrist, we want the toes to not do as much of the movement, but really begin to isolate that movement into the ankle. Release to the other side, and again using the wall, and go the other direction. Good. So that is your quick sequence for kind of from the neck all the way down to the ankles. Do it every day and your body will thank you.